People selling, buying a load of aspirin, a bucket of aspirin, inside the Agbo mixture.
Now there is what is called cross resistance.
All these chemicals are not well researched.
Resistance to so many anti-infectives, like anti-malaria, like antibiotics. Take it every morning. I used to take it every morning. If I do not take it like this, I will not feel all right.
What happened? By the time those number of cells in the kidney are worn off and died, the person now comes down with what? The chronic kidney disease or kidney impairment.
Or in a cup and drink it. So you've taken a dose higher than what is supposed to consume at a particular time. Now it poses a danger of organ failure.
Every day, millions of Nigerians drink Roadside Agbo, either for pain, energy, detox, or general body balance. But what if this popular mixture is quietly harming our kidneys?
Because
number one, so any other thing,
Which kind of medicine?
Malaria
medicine. You know they cure your own malaria.
Saying that the kidney being created by God too, and each of those kidneys has some cells right from birth, and those cells are designed to do what? To filter waste product, toxins from the body, and they do it perfectly well in such a way that those toxins or those waste products, those chemicals doesn't build up. So in such a way that persons metabolic or whatever the system, the menu in the body, that means the menu in the body is clean, sterile, and free from toxins, and that's what the kidney does. It also does all that function in terms of contributing to the formation of blood, also helps in the bone metabolism. It also helps its other function in terms of even protecting the body. But its main function, like I said, is that filters the waste product from the body. And that's what makes sure that every day we can make urine and those toxins are not building up in our body unnecessarily.
Up to 5 to 6 years now, I will tell you that use of Agbo or roadside herbal products is one of the things, as in if I say is part of them in this area, then I'm not far from the truth. Because many of them believe, when you interact with some of them and ask, why are you taking it? They say, I take it every morning. I used to take it every morning. If I do not take it like this, I will not feel all right.
From the medical point of view, any organ in the body that receives a lot of blood will definitely, because it means that every toxins or chemicals or anything in the blood will get to it more than the other. So the kidney, it causes something a cardiac output. So the blood flow from the heart, 20-25% of that gets to the kidney, and that's large, meaning that 1/4 of all the blood output from the heart gets to the kidney, and it goes like a cycle. So if you see it's an organ that receives that large volume of blood, it means that whatsoever impurities in the blood will be exposed to it. And for the fact that once those get there, in doing its filtering function, in filtering those toxins and anything that gets to it from the blood, it does in such a way that is actively. And so doing it actively means that those things are more concentrated in the kidney, and so if they are toxic, the kidney tends to bear the brunt.
Many of them are informed and learned, right? Many of them are informed and learned. So ignorance.
In that regard, you see the kidney being prone to damage from any of those toxins, any of those toxic things that flow in the blood, because it wet the kidney. That means they will wet the kidney so much, and the kidney in bid to do what to regulate, also make sure it concentrate it in much. And there is a part of the kidney also that will mention that the oxygen supply is a bit minimal. So if you balance it, it's very active in its work with few oxygen supply. So if there's anything that is not consuming much of those oxygen at the expense of the kidney, then the kidney will be at risk for that. So it makes the kidney to be prone to injury because of the lack blood flow, fact that it concentrates most of those chemicals on those oxygen, and the fact that a part of it has the oxygen flow that is reduced, coupled with the work it does. So if you balance them and look at it, then makes the kidney to be at risk of injury from those toxins.
You compare that they don't have, due to the high price of orthodox drugs, they can't be able to get an orthodox drug. They're looking for alternative medicines.
Yeah.
So they go for Agbo or other ones, other things they normally take. Yes.
In our own setting, this roadside Agbo, you can't really speak of what constitutes this, what the people that are selling it made of it. But we have instances. Let me just give an instance where someone quoted people selling and buying a load of aspirin, a bucket of aspirin, inside the Agbo mixture, so that when they drink it, and we know aspirin, a load high dose of it damages the kidney because it narrows blood flow to the kidney.
Now, when you look at all those herbal medication, unregulated, like this Agbo of 18, there was a time I was discussing with somebody, I was talking with somebody, though unverified, but the person told me that this Agbo malaria, actually what they normally put inside is chloroquine tablet. They mix it with chloroquine. They grind chloroquine tablets and mix it with. Then this Agbo typhoid, the one they call Agbo typhoid, that they mix it with chloramphenicol capsule. Now, the problem is this: specification. Most herbal, general problem of herbal medications is specification, dosage form.
The liver is also spare because it can the liver also detoxify things, and so in the bit of detoxifying thing, it can also bear the brunt of those large dose of toxin because it's not regulated. They don't give this is the dose of this. They mix everything together, hoping that this person's body will be able to clear. But there are some people that their organ are at risk before, so in getting to them, the kidney, the liver, and some even the GI, the stomach, it also affects, and every other cells and tissue also can be bear the brunt of this roadside herbal concoction because of the what it's being made of, which we can't really you can't really say the essence of it.
My most concern is that those drugs, actually what they're taking, they don't know what is the content of what they're taking. What actually, I'm not saying that herbs are not good. Herbs are good, but how are they prepared? How a herb is prepared is very, very important, because boiling can denature some of the active ingredients of the plant, of the herbs that are boiling.
Okay, how can unknown herbs combination, especially the ones that contain alcohol content or incorrect dosage, affect the kidney function?
Okay, let me use in this part of this, in the world, in a poor resource center like Nigeria, and all these chemicals are not well researched. So let me just pick a context from what is known in China, what we call Chinese herb nephropathy. That is, in their own herbs, they use for like a slimming tea. The content there is aristocolic acid. That's what they've researched, and it has been shown that people that takes it in China, because they take it in China, it tends to affect. I don't know the word to use so that we can understand. There's a part of the kidney, and the kidney has the part that sieve it. After sieving it, it goes through a tiny tube. That's the tubules. Do you understand? And surrounding those tubules, the interstitium, those are the surrounding area. It has been shown that this aristocolic acid tends to do what damage these tiny tubules, and those tubules are plenty in numbers. And once you have a sieve and whatever you are sieving, it has done its work, but instead of it going down the tube that you do that has been damaged. Then what happened to this? At the end of the day, it's also got damaged. So it has been shown that it damaged those tubules and the surrounding area. And once it does that, it leaves it with scar. And so by the time you have a lot of those tubers and the surrounding area, which is the articulation damage after a long while,
there might be a reaction that will take place to might convert it to a poisonous substance because of the process is gone. So in herbs, you have to understand, because in extraction of components of herbs, you must know about polar and non-polar.
Yes.
Polar substance, the one that can be soluble in polar and non-polar substance. That's why you see some uses alcohol.
In Nigeria, healing does not only live in hospitals. It lives in roots, in leaves, in bottles carefully arranged on wooden tables, at bus stops and street corners. Across cities and villages, millions rely on traditional medicine, not just because it is affordable, but because it is familiar, because it is trusted, because it has been passed down through generations. In the informal sector especially, Agbo is more than just a mixture. It is a culture. It is belief. It is first aid. In every park, every roadside, someone is selling a cure for fever, infection, infertility, or body pain.
If you look at the population of people coming down with kidney disease now, we now see young people, and young people, but they are asking, there are always one history of herbal concoction, some aside the substance, the heroin and the rest, which have been shown to also cause damage to the kidney.
My concern is that a lot of things are going on, and people are going down with a lot of issues, a lot of ailments.
But in a time where kidney disease is rising, we must ask a difficult question. What is Agbo really doing to our bodies? In this documentary, we sat down with young men who drink Agbo regularly to hear their experiences. We spoke with a nephrologist about what prolonged herbal mixtures can do to the kidneys. We visited a community pharmacy to understand the risk of unregulated combinations. And we met with a certified herbal practitioner who believes traditional medicine, when properly prepared, can still be safe and effective. So where does the truth lie? Is Agbo really safe? Or is the danger in the unmeasured roadside version we consume without question?
Now, let's assume that what the person told me is the reality, that they use chloroquine. Now, there is what is called cross-resistance. That every medication that has similar structure with chloroquine, that now there is a resistance. I'm not surprised why we're having so many anti-infective failures, antibiotics failures, anti-malaria failures. That you use this one, it's not working, it's no longer working because of what? Resistance. And these are part of the problem. It's not only irrational use of drugs, orthodox drugs, but these are part of the problems.
Amongst people from the informal sector, because we know that they are like the major consumers,
yes.
And that's because of their economic profile.
Yes.
They will rather not want to spend money to go to the hospital. They will want to treat themselves. But I know this is it's a private facility. They might not also have that opportunity to come to places like this. But maybe from your experience and your interactions with your other colleagues, do you get to see people from the informal sectors actually also breaking down?
Yeah, the kidney disease. We have some there too, and we have them. Adulthood, like I mentioned, and by the time you're asking history, even if they have a risk to develop kidney disease, by the time they're asking them, oh, when the other things start and they're giving you the day, oh, do you take this? Oh, yes, I do this, and we mentioned those diclofenac, those things that they load a lot. Those are things that will now make them succumb to kidney disease. We have them. They have it to come here for dialysis. They come here for clinic. You also see them at the public hospital, at the teaching hospital also. So they popping at them just the because you won't be able to pick other traditional risk factor for kidney disease in them. It may not be hypertensive, they may not be diabetic. It may just be the information you may get from them.
I have a case, a scenario where somebody said the mother sent Agbo sent herbs from village. And after using that herbs, why using the herbs? She started having hotness of the chest, something like gastritis, and when sent to lab, lo and behold, she came down with ulcer. So, and ulcer has no cure. You manage it.
This disease is not like malaria or typhoid. If you have malaria within 2 or 3 days, you will present in the hospital. But when it comes to kidney disease, it takes its course, it runs its course. But when you are picking them, they are already in stage 5. And so most time they may not relapse. But the few 30 signs that will tell people to watch out for: your urine. If you notice your urine is foamy, it's a 30 sign. Like the patient I saw come down and say, when do you notice your urine becoming foamy? They mentioned like 9 months or a year before them. But the husband say, I told you, I noticed it, I kept telling him, but he just wave it with you know. By the time she was coming, it's already on the end stage, it's stage 5, because kidney disease, chronic kidney disease, stage 1 to 5. So the 30 signs, if you are having history of passage of floating urine, your urine is foamy, you understand? It's a swelling. By the time you're having leg swelling and the rest, most likely the kidney will have gone to maybe stage 3 to 4. At that point, the kidney phase in regulating fluid, but they tend to develop fluid, fluid in the leg swelling. You can present with that. They can also be complaining of tiredness. At that point, they've gone around to stage 3B or 4. So the 30 sign, most time, is just encourage people, if you have a family history, go for checkup. They make it a routine, because they feel at that stage, 1 stage 2, you may not have any symptoms, because the way God designed the kidney is that the 800 to 1 million cells from birth per kidney.
I had a chat with a certified Herbal practitioner, Ikeja, and she really explained in depth about how she's been serving the community using traditional medicine. She has never had a job in her life except this. According to her, she learnt it from her mom, who also learnt it from her own mother, and she's been providing this care to people within the community, and to the glory of God, she claims that there has not been any casualty. She is trained and she has a certification to back her training. So part of what I was also able to question her was, in comparison with those who work traditional medicine, what does she think about those ones? Because could those ones have potential threats to the health? And then she said she can't really speak generally on them, but then for traditional for those who work traditional medicine in the heat and the sun, she was concerned about the fact that it might not be healthy concerning they're hawking all of these things. There could be interaction with plastic or whatever. And then she also made mention of the fact that you buy from someone who is hawking today, you don't know what the person gave you. If anything happens to you tomorrow, where are you going to go find such person? So she would encourage, if you want to go for any herbal medication, you should come to someone like her who is much more experienced, who has a let me say a place where they are situated and they're not always in motion. And we also had the opportunity to speak to some of our consumers to know why they trust her to be their care provider.
One plant contains hundreds to thousands of drugs. 100%. Most of the drugs, formulation of drugs started from herbs, from plants, specifically from plants, organically from plants and animal. That's where the formulation of medication started. So before testing and other processes, went to lab, try to synthesize it in the lab, to synthesize the molecule in the lab. Now, let me give you an example. Artemisinin is an anti-malaria, but first it was synthesized from plants. In China, they call it pingosu. It was synthesized from plants, and so other drugs. Now, assuming somebody is on a medication, orthodox drugs, prescribed medication, and use a herb that have the same, that contains the same ingredient with the active ingredient of that very drug, it's an overdose.
Thank you so much, sir. So what would you say is the difference between regulated herbal medicine and roadside herbal mixture from a kidney health perspective? What's the difference between that regulated, because we know that some herbal mixtures are regulated, and then we know that the roadside herbal mixtures are just, anybody can just begin to cook up something, set up a stand in a motor park and starts to sell. So what do you think is the difference between that regulated herbal medicine and then the roadside herbal mixture from a kidney health perspective?
The regulated, I think, the different because we still have a lot of work to do. I mean, the NAFDAC, just that they might have for the regulated herbal medicine, they may give them a pass that these are not harmful to the body. You understand? But they also overhype you and say, this one can cure kidney disease, can cure liver disease. That's my own concern with it. They can cure with all those herbal regulated one. They've done well in making sure that these are not harmful to the kidney to this before they gave them the approval in the first place. But they tend to now, by the time you are reading through all those about it can cure, it's more like it's multi-purpose. It can cure this, can cure that, and it's misleading. We have people that have kidney disease, so maybe at stage 2, 3, and when they settle for all those things, they take kidney disease, and before they are coming back again, so they're already gone down because of the fact that they trusted what these people want. So that's my only. It may not be harmful to the. That's why I tell people, if you have money, all those are back. If you have money, you want to throw around, buy them. But I will tell you that they are not so super. They don't do much as compared to what they've said that we can do this, we can do that for the regulator bar. I know people we are going back to the back and you see them different international companies. All these I think Forever stuff and stuff. They bring in. But I tell people if you have the money enough and you don't have the you think you can afford it, you can, but you will not do because and we see our patients going for there are different type of for kidney I think kidney detoxification and detoxify, they have different use for those, but those things doesn't do, and they may not be harmful, but it doesn't also do like what they mentioned. The other one though, no, this one is more worse off.
That one is dead on arrival. We spoke to Spencer. Spencer he works as a tax collector, and as a tax collector it requires a lot of energy to work out to run around, to go about his daily activities. And according to him, he has been taking herbal medications from her and without any complications so far, but he doesn't always patronize roadside hawkers for the same reason Ikeja gave, because he buys from someone who is working today. He doesn't know when he's going to see such person again. What if he has a complication from consuming that medication? And then he trusts that a facility like Mama Ikeja, they know the required quantity and what they are serving. Like, he just believes that there's a level of trust because she is positioned there. If at all anything goes wrong, he knows where to go back to. And we also spoke with another consumer from our shop who also believes that he has been taking herbal medications from birth, and then since he arrived in Lagos and he's been working as a organizer, he has never had any reason to even want to go to a pharmacy before. He purchases all of his medications from her. If he has any form of ailment, maybe they call it jadi in local palace, and then maybe hemorrhoids, yes, or maybe he has fever or infection, he would come get medications from Ikeja's shop.
Alcohol, we know there is addiction, and alcohol addiction sets in. Secondly, so many components of herbs are soluble in alcohol that when comes in contact with alcohol, they release their active ingredients into alcohol. Some at high, like paracetamol is very soluble in alcohol, very soluble in alcohol. Now let's assume that a plant that contains acetaminophen or other painkillers come in contact with alcohol. There is extraction into that, and it might be in a dose that's higher than the actual dose the person is supposed to use. So you see that taking it, and without, because you know that you don't have those, they might put it in a shot or in a glass or in a cup and drink it. Then you've taken a dose higher than what is supposed to consume at a particular time. Now it poses a danger of organ failures, mostly organ failures. Now gastritis is a related one.
Okay, so what advice would you give to individuals who currently consume roadside agbo regularly?
The advice I would give them is to stop. because it's no matter how cheap it is, at least it's not free. Even if it's free, you won't use your hand to bring in something that will do harm to you, because the reason being that by the time the kidney disease or whatever organ damage, when they comes down with it, the cost, the burden on them and the family is more than what that little amount they are paying for it. It's more than it. So the best thing that instead of you wasting your money, your time, and putting your health at risk with this, why don't you just do healthy food? You should take healthy food, vegetables food, take enough water. Instead of starting their day with that, they should start their day with water, which is good for the kidney, instead of settling for roadside herbal. And so that's where awareness and maybe campaign will have to go to them, because some of them, they are used to it, that become an habit, and until when they say the implications of this, that's when you'll be able to do without it. But my advice for them is no, because they are doing more harm to their body than any good at all. We ought to be at least brothers keeper, be a good vanguard. The risk factor for this kidney disease to be at our fingertips, to encourage and to also to help people. And then the issue of prevention is what we emphasize more. Better prevented by the treat. So preventing kidney disease, and that's what we emphasize for us to do away from all these risk factors that cause damage to the kidney. You can't afford to fry your kidney by not taking enough water. Take enough water, eat vegetables, live healthily, you understand? Eat fruits and things that are at risk of developing BP, your salt and maggi, caffeine, painkillers, and the rest. You do away with them. And those at risk for kidney disease, they should go for screening, and we should always go to the hospital for checkup. Those are informations or things that we should do and advise others to do, because it's better preventing, because the burden of kidney disease is more, and the government is just is still struggling with it. We are not lucky like US, UK, that people dialysis cover under insurance. It's a big money, and that's why you see our patient dying after some months or year, because they can't sustain dialysis. So the body is more individually, the family and the government is not spared. And so the best thing we could do is to all speak out and encourage people to go for screening, to good health lifestyle, and encourage anyone around to go for their checkup. I think those are informations, are things that I think every one of us to see, and we should promote healthy lifestyle, encourage screening, and we'll see how we go from here.
If we understand that there's different processes of extracting those active ingredients, you can macerate, by maceration, by decoction. There are so many methods of extraction. Maceration, you can put it in a particular solvent, allow it to stand for 2 days. What you need to do every morning or in the evening, you just bring it, shake it, then drop it. Allow it to stand for 2 days, but you'll be shaking it morning and evening to get the active ingredients. Then after that, you can decant the solvent to get the real drug, which you can process into another thing. But you see them, instead of maceration, they will boil it, heat it to a very high temperature, which can denature, which can lead to another thing, which can break down into toxins.
Who exactly
good at risk of kidney disease? Okay,
yes.
Let me start one by saying family history. There are some kidney disease that runs in the family. There's a genetic component to it. You have a woman that had done a kidney transplant, the son is coming down with kidney disease. There are some kidney disease like that. People that have hypertension, just the traditional risk factor. Hypertensive, you have a BP, which is people say, when you ask people, are you hypertensive? They say, I don't have hypertension. Do you have BP? Yes, I have BP. I don't know why they find it difficult to separate it, because the same thing, whether you're hypertensive. People that are hypertensive, people that have diabetes, but those things does damage to the kidney. You understand? And recurrent infection, urinary tract infection, also predisposed, which require pyelonephritis, that can become chronic, also predispose people to develop this. Then when you now notice some people that also tend to have all those conditions, nephrotic syndrome, that make them have leg swelling and the rest, over time they can also progress to kidney disease. So those are the people that are at risk for kidney disease. They should be the one checking their kidney test more frequent than just the general population, because you have hypertension, Potential can progress to kidney disease. Diabetes also can progress to kidney disease. Do you understand? The people that have prostate enlargement, they can have obstruction to the flow of urine that over time cause damage to the kidney. Those one also should be taking their kidney, because we have cases like that, prostate enlargement that will now cause a background a secondary damage to the kidney. They also need to be on the lookout for their kidney wherever they are going for their checkup. So those are the people we list as having risk for kidney disease.
Thank you.
And I might also mention finally people that have developed a form of acute insult to the kidney before, either during pregnancy they have acute kidney injury and it resolved. Those ones are at risk. They also need to monitor their kidney